Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and IVF specialist. Today we are going to discuss about male infertility, especially what are the investigations that we should do in case of male infertility. The first investigation is of course the semen analysis. But remember, a single abnormal semen analysis does not make any sense. We have to repeat it. So when we should repeat it? If it's a mild problem, then we should repeat it after 3 months. Meanwhile, you can advise some antioxidants or some lifestyle measures. On the other hand, if the problem is severe or there is azoospermia, we can't afford 3 months time. In that case, we should repeat it as soon as possible. But of course, you have to remember from which lab we should check the semen analysis. Therefore, it should be checked from authentic laboratory. Now, if the second semen analysis also shows abnormal, the further investigation and treatment depends on the underlying factors and how severe the problem is. If it is mild, usually no further investigations are needed, but if it is severe, we should investigate. Number one, to find out the cause. Some of these cause may be correctable. Number two, some of these cases of male infertility may be associated with some genetic problems that may be inherited from father to the baby. So we have to ensure the birth of a healthy baby, because in infertility our motto is to have healthy baby. Just only achieving pregnancy is not our aim. Therefore, genetic investigations may be required. And thirdly, we have to remember infertile men are at risk of developing some other serious diseases like cardiovascular disease and cancer. Therefore, thorough investigation should be done. And first investigation should start from history and physical examination. Physical examination is important mainly for two reasons. Number one, vas difference, because if you find bilateral absent vas difference, it may be associated with cystic fibrosis carrier, which you may miss if you don't do physical examination. Next is you have to check for varicocele clinically. Please don't advise ultrasound to detect varicocele, because only the clinical varicocele that can be treated, not the ultrasound detected varicocele. Next, of course, you have to take the help of ultrasound sometimes. Particularly transrectal ultrasound can be useful if you are suspecting some obstructive pathology like absent fructose in azoospermia or low volume semen or low pH semen, or if there is ejaculatory duct obstruction, or that is ejaculation problem, or of course if there is vas difference absent. On the other hand, scrotal ultrasound should be done if you find something abnormal clinically or if the clinical palpation is difficult. Next are the hormonal investigations. We should start from hormone testing like FSH, LH, testosterone, estradiol, and of course blood sugar testing is important. Prolactin and TSH should not be checked routinely, only if there is strong clinical suspicion. Regarding these hormone investigations, if FSH, LH low, that means you are dealing with hypogonadotrophic hypogonadism. In that case, you should check for pituitary MRI and prolactin should be tested, because this is the only treatable cause of severe male infertility, and if you give hormone therapy for say 6 to 12 months, the sperm parameters can improve, and sometimes some of these men can become father naturally. On the other hand, these hormonal investigations may be normal in obstructive cases or some idiopathic cases. Again, FSH, high FSH means there is some testicular pathology. In that case, look for the underlying reasons. If there is no suspicion of obstruction, if it is indicating the testicular failure or idiopathic cases, in that case we should check for chromosomal acid. That is both karyotype and Y chromosome microdeletion. Both the tests are important because karyotype may reveal some diseases like translocation, deletion, inversion, and sometimes Klinefelter syndrome. These are quite common. We encounter these problems many a times. Therefore, this should be done. And if this translocation or Klinefelter syndromes are there, that does not mean they can't become father. They can't become biological father. Of course, in that case, we have to go for pre-implantation genetic testing to ensure the birth of a healthy baby, so that the genetic problem should not be transmitted to the offspring. On the other hand, Y chromosome microdeletion should be done if sperm count is less than 5 million or azoospermia. This is particularly important in azoospermia because if Y chromosome type A and B are absent, there is virtually no chance that you will get the sperm from the testicles. Therefore, surgical sperm retrieval should not be done. On the other hand, if there is deletion of C and D gene in Y chromosome microdeletion, the prognosis is good. You can get the sperms from the testicles. Even sometimes you can get sperms in the ejaculate. Next genetic testing, which we should not ignore, if there is congenital bilateral absent vas deferens, cystic fibrosis testing should be done in the male partner. If the male partner is the carrier of cystic fibrosis, then female partner should be tested, and if both the partners are carriers, in that case, of course, you should go for PGTM, that is pre-implantation genetic testing for Mendelian disorder. There is another particular investigations which is gaining more importance nowadays, that is sperm DNA fragmentation. But we have to remember this test has some limitations when you should test it. Particularly if the female partner is suffering from recurrent miscarriage, 2 or 3 or more miscarriage, then male partner should be tested for sperm DNA fragmentation, or if there is unexplained recurrent IUI or IVF failure, in that case. Otherwise, routine testing of sperm DNA fragmentation is not recommended. There are some other specialized tests that can be considered in case of male infertility. Like sometimes we check the semen for culture, but ordinary cultures sometimes fail to detect some particular organisms like chlamydia or gonorrhea. In that case, you may require urine testing or urine after prostatic massage that can be tested for chlamydia and Neisseria by nucleic acid amplification test, and all these tests are available from specialized laboratories. So in a nutshell, if we are dealing with male infertility, we have to see how severe is the problem. Then we have to investigate thoroughly, but in stepwise manner. First, we should do the semen analysis and we should repeat it. Then physical examination, then indicated ultrasound examination in selective cases, then hormonal test, then genetic tests which include karyotype, Y chromosome microdeletion and cystic fibrosis testing. Then sometimes you have to go for sperm DNA fragmentation. And of course, sometimes the culture for Neisseria, gonorrhea and chlamydia. And of course, pre-implantation genetic testing is a way forward in some cases. Thank you.